Today, I'm presenting a public health issue that is growing, but not being fully addressed at the level it should be. Poly substance impaired driving, specifically the combination of alcohol and cannabis. Over the course of the semester, I analyzed Somerville's community health needs, financial structure, and strategic priorities. I also looked at how leadership decisions, funding allocation, and community factors all interact to influence health outcomes. Based on that work, I developed a proposal that focuses on improving prevention efforts while staying realistic within the city's financial constraints. The goal of this presentation is to walk through the data, explain why these issues matter, show where the current gaps are, and present a strategy that is both practical and scalable. At the end, the goal is to get feedback on whether this is something worth investing in at a community level. Motor vehicle crashes are one of the leading causes of preventable injury and death in the United States, especially amongst young adults. What's changing now is not just alcohol impaired driving, but also the role of cannabis, particularly when the two are combined. Research shows that when alcohol and cannabis are used together, impairment is significantly greater than either substance alone. That includes slower reaction time, reduced attention, and impaired decision making. The issue here is that public perception hasn't caught up. A lot of people understand alcohol is dangerous when driving, but cannabis is often seen as less harmful, which creates a gap in behavior. From a public health perspective, this matters because it increases crash risks, strains emergency services, and adds to healthcare costs. This is one of the areas where prevention can have a direct, measurable impact. To understand why this matters locally, you have to look at Somerville as a community. It's about 81,000 residents, and it is very diverse and relatively young. One of the key points is that Somerville has a higher percentage of Hispanic and Latino residents compared to the rest of the state, and slightly higher poverty rates at around 12%. Even though it's a highly educated city, those economic disparities still exist and play a major role in health outcomes. That matters for this issue because access to transportation, awareness of risk, and the exposure to prevention messaging are not evenly distributed. So when we talk about impaired driving, we're not just talking about individual decisions, we're talking about how community structure and resource influence those decisions. That's what makes this a public health issue, not a behavioral one. Substance use patterns are evolving, especially with the legalization of cannabis. It's becoming more normalized, which isn't necessarily a problem by itself, but it changes how people perceive risk. The big issue is that people do not fully understand how cannabis affects driving, especially when combined with alcohol. The data shows that polysubstance use increases impairment significantly, but awareness of that is still relatively low. So what ends up happening is people make decisions based on incomplete information. They may think they are okay to drive because they don't feel as impaired as they would with alcohol alone. From a public health standpoint, that's a communication failure. This is exactly where targeted education and prevention can make a difference by aligning perception with reality and reducing risky behaviors before it leads to injury. This chart isn't directly about impaired driving, but provides context for substance use trends in the community. What you see here is that opioid overdose rates have significantly increased from 2018 through 2021 before slightly declining in 2022. Even though Somerville is slightly below the Massachusetts average, the trend still shows a clear increase over time. The reason this matters is because it reflects a broader pattern of substance use challenges in the community. These issues don't exist in isolation. When substance use increases in one area, it often shows up in others, including impaired driving. So this isn't just about one behavior, it's about an environment where substance related risks are becoming more common. That's why prevention needs to be the strategy, not being proactive and not reactive. When we look at the budget, the biggest issue becomes clear pretty quickly. It's not a lack of resources, but it's how those resources are allocated. Somerville's total budget is around $359 million, but Human and Health Services only receive 4.55 million. That's just 1.33% of the general fund. At the same time, police and fire departments receive 30 million each. Those are essential services, but it shows that most funding goes towards response rather than prevention. Public health is designed to reduce the need for those emergency services in the first place. So when it's underfunded, those systems become reactive instead of proactive. That's the gap this proposal is trying to address. Even though the city's strong asset strong, the financial picture becomes more restrictive when you factor in liabilities. Somerville has 1.13 billion in total assets, which on paper looks very strong, but it also carries about 646 million in liabilities, resulting in a 57% debt to asset ratio. That's important because it limits how much flexibility the city actually has when it comes to new spending. A significant portion of its revenue is already committed to long-term obligations like debt service, pensions, and infrastructure investment. So realistically, we can't just propose adding new programs without thinking about where the money is coming from. That's why this proposal focuses on being strategic, either reallocating existing funds towards prevention or leveraging external funding sources like the federal and state grants. It's not about spending more, it's about spending smarter and aligning resources with long-term public health impact. Even though Somerville has a strong total assets, the financial picture is more complicated when you look deeper. The city has over $1.1 billion in assets, as stated, and 646 million with that same debt to asset ratio, 57%. That level of debt limits how flexible we can be. When it comes to new spending. So we can't just ask for a large increase in funding without considering, as said earlier, where the money is coming from. We need to focus on being extremely efficient with it. The SWOT analysis helps summarize where Somerville stands overall. Strength-wise, the city has strong data systems, community engagement, and access to healthcare resources. But there are clear weaknesses, especially around funding allocation and structural inequities like housing and income disparities. Opportunities include access to federal and state funding, as well as the ability to build on existing programs rather than starting from scratch. The biggest threat are increased substance use trends and financial limitations that make expansion difficult. So the takeaway is that Somerville has the foundation to address the issue, but needs better alignment between funding strategies and emerging risks. The proposed intervention focuses on building off what already exists rather than creating something entirely new. That includes expanding current alcohol prevention programs to include cannabis and polysubstance messaging. It also includes improving data collection so we can better understand how often multiple substances are involved in crashes. Another key is promoting safe transportation options like ride sharing or designated driver programs. The goal is to address the issue at multiple levels: policy, community, and individual behavior. This approach follows the socio-ecological model, which is considered the best practice in public health. The goals are designed to be specific and measurable. The first is to reduce incidents of impaired driving, particularly involving multiple substances. The second is to increase public awareness by at least 20%, which would be measured through surveys. The third is to expand partnership with local organizations to improve outreach, implementation. And the fourth is to improve data collection so future decisions can be more targeted. These goals make it possible to track whether the program is actually working, which is critical for long-term sustainability. Funding for the proposal doesn't need to come entirely from the city's existing budget. There are federal funding opportunities through organizations like the CDC and the NHTSA that specifically support injury prevention and traffic safety programs. There are also state-level funding opportunities through the Massachusetts Department of Public Health. On top of that, existing programs can be modified rather than replaced, which will reduce cost, and partnerships with hospitals and community organizations can provide additional support. So overall, this is a financially realistic approach. From a cost perspective, prevention is consistently more efficient than treatment, especially when we're talking about injury-related events like motor vehicle crashes. Once a crash happens, that cost quickly adds up. Emergency response, hospital care, rehabilitation, and long-term disability care in some cases. If we can prevent even a small number of those incidents, the savings are significant, not just financially, but in terms of quality of life and overall community health. Fewer crashes means fewer ER visits, less strain on emergency services, and lower long-term health costs. What makes this issue unique is that it's highly responsive to intervention, education campaigns, policy changes, and improve awareness can shift behavior relatively quickly compared to something like chronic disease. So the return on investment here is strong. By putting resources into prevention upfront, the city can reduce downstream costs while also improving safety and outcomes across the community. The issue also has a strong equity component. Community with fewer transportation options are more likely to be affected by impaired driving risks. They may also have less access to prevention messaging or education. That's why any intervention needs to be culturally appropriate and accessible in multiple languages. The goal is to make sure the benefit of preventions are evenly distributed across the community. From a leadership perspective, this reflects how public health actually works in practice. It's not just about healthcare, it's about coordinating across sectors like transportation, policy, and community organizations. Strong leadership involves using data to guide decisions, communicating clearly, and building partnerships. It's also about balancing long-term strategy with immediate action. That's exactly what this proposal is trying to do. To wrap everything up, polysubstance impaired driving is a growing issue, but it's also highly preventable. The main gap right now is not awareness of the problem, it's how resources are being allocated to address it. By making targeted adjustments, leveraging external funding, and building on existing programs, Somerville has a real opportunity to reduce risk and improve safety. This is a practical, scalable approach that aligns with both public health principles and financial reality. The goal moving forward is to get feedback and determine whether this is something worth prioritizing at the community level.